Now, that video was posted on an account that belongs to a doula, hypnobirthing instructor, and student midwife. And this is the caption on the video. No, perineal massage is not making the process go faster. No, perineal massage is not making her tissue stretchier. In fact, perineal massage while pushing increases her likelihood of tearing, and your OB is probably only doing it because it makes them feel better and like they are in control of the process. It's a matter of them showing you who is boss. It is unnecessary, it is wrong, and it is assault. I'm one of those OBGYNs. We're going to talk about this. Now, when it comes to perineal massage, it is traditionally done in 2 time periods. Antenatal, there is some evidence that supports doing it starting at 34 weeks where the patient can do it for themselves. And then there is perineal massage that's done during the 2nd stage of labor while pushing. And that is intended to decrease the perineal muscular resistance and reduce the likelihood of lacerations at delivery. Now, the evidence for antenatal massage, perineal massage, is not very strong. In fact, some people are starting to shy away from recommending it. I'm kind of on the fence from what I've read about whether or not I still support. Now, there are a lot of studies on perineal massage during the 2nd stage of labor, with and without warm compresses. So I'm not going to talk about warm compresses for this video, but there is pretty significant evidence to support the use of warm compresses during the 2nd stage of labor as well. And I'm going to post some studies here in a second, some PMIDs if you want to look at the studies yourself, but I'm just going to summarize some of the findings. Let's see. Perineal massage during the 2nd stage of labor may help reduce 3rd and 4th degree lacerations. Meta-analysis of data from 2 of the studies in this big study found that perineal massage during the 2nd stage of labor reduced 3rd and 4th degree tears when compared to the hands off the perineum, but was not associated with significant changes in the rate of birth with an intact perineum, meaning no tears at all in the perineum. In another study that looked at laboring patients greater than 36 weeks, they found that compared with no massage, perineal massage applied by a midwife during the 2nd stage, this included 9 trials, over 3,000 participants. Number 1, reduced severe perineal trauma. Number 2, reduced episiotomy. Number 3, increased the incidence of intact perineum, meaning no tears. There was another study that showed that perineal massage and warm compresses technique increased the incidence of intact perineum and reduced the incidence of 2nd degree tear, episiotomy, and obstetric anal sphincter injury, which would be like with a 3rd or 4th degree laceration. Now, it's important to know that any of these studies, they don't have the best methodology because you can't control someone's technique, the amount of pressure, you can't control the type of tissue that the patient has. There are a lot of things you can't control. So we have to take a lot of these studies just based on what is being looked at with a little bit of a grain of salt. So this is what I recommend. If you're going in to deliver, ask your provider, do you do perineal massage when I'm pushing? And if so, what does that look like? If your provider does do perineal massage, ask them at what point do you start doing that? What techniques do you use? What are your personal thoughts on the benefits of perineal massage? We can ask those questions. And there's also some anecdotal evidence. I think every provider has their own views on the benefits of perineal massage, when to do it, how long to do it. I'm one of those providers. So I think the best thing to do would be just to talk to the person who's delivering you to see what their thoughts are, and then give your thoughts.